Whole body bone scans are done with patients with indications of primary or secondary tumors, stress or cold fractures, evaluation of trauma, osteomyelitis, avascular necrosis, chronic bone pain, RSD, bone graft viability or loosening of a prosthetic device, arthritis, detection of Paget's disease, or detection of loosening of a hip or knee prosthesis. Once being injected with the radioactive medication, the patient will need to wait around 3 hours prior to being imaged. Once the patient returns to the facility, the patient will need to use the restroom to relieve any extra activity within the patient's bladder, and then images are taken from head to toe. The patient will lay on their back and slowly come out from between the detectors so that the full image is captured. Images are processed on either black on white or white on black by request of the physician, and further images are taken if required. Often extra images of the patient's arms or feet may need to be taken if they are cut off when they are being imaged.
And now we'll position Gracie for a whole body sweep. First, it's important to remove any metallic items in the pockets, chest pockets, or necklace of the patient. Gracie, do you have any metallic items in your chest pockets, side pockets, or bottom pockets? You can keep that on. It's quite okay. Next, we'll position her on the table. Gracie, could you have a seat right about here with your head in that direction? Thank you. I'm now going to place a comfortable pillow underneath her knees to help relieve any strain on her lower back. Gracie, I'm going to place this under your knees to help you relax, okay? We also have a rubber band. This band is to be placed around the patient's feet to help keep everything symmetrical. Hi, Gracie. I'm going to put this around your feet to help keep your feet together, okay? You let me know if it's uncomfortable. Excellent. And now, some places use arm boards or sheets to help the patient keep their arms relaxed. Gracie, I'm going to place this sheet across your chest with your arms on top of it in order to keep you in a comfortable position. This will allow you to relax. Are you ready? Thank you. Please lift your arms up like you're doing the wave. Excellent. Bring your arms down. Don't bring that one tightly and snugly over. And this one tightly and snugly over. Much like if you were swaddling a baby. Next, we'll describe what the camera is going to do. Gracie, you're going to be underneath this camera. It may come close to your face. Some people who are claustrophobic do not like that. I can place a washcloth over your eyes to help you more comfortable. Would you like that? Now that we have her blindfolded and tied up, the fun begins. For a full body sweep, we place the patient on the table completely under the collimator. Over time, for positioning, Justin, stop. Stop, okay. Now we will place the patient underneath the camera to start acquiring images. It is important to make sure that the patient's head is completely underneath the camera in order to gain full pictures. You're doing excellent, Gracie. Encouragement to the patient is important. Just relax. Oops. Then, depending on if your camera is set up to have an auto contour mechanism where the camera adjusts according to the shape of the patient's body, you may or may not have to bring the camera heads closer. In this instance, we will bring them as close as possible. Now, to simulate what the camera would do, I will pull Gracie slowly out, and the camera will be taking pictures continuously through the entire event. Gracie, how are you doing?